Hello friends, welcome to my channel Med Simply Learn. In today's video, I will be discussing about hemolysis, which is a common pre-analytical error. So, first of all, what is hemolysis? Hemolysis, by definition, is rupture of RBCs or the red blood cells, releasing the hemoglobin and other contents of the RBC. What visually, how can we recognize hemolysis? Serum or plasma turns pink or red in color. Normally the serum is light yellow in color, but if it is appearing pink or red in color, then it gives an idea that sample is hemolyzed. And what impact hemolyzed samples have? They interfere with the accuracy of various laboratory tests and overall patient management. Also, hemolysis is most common cause of rejection of the lab samples, and repeat testing due to this pre-analytical errors increases the financial cost to the laboratory. Now, what are the causes of pre-analytical hemolysis? First important cause is traumatic venipuncture. What that means is when we are withdrawing the sample, at that time, if there is a trauma to the vein due to the incorrect angle of withdrawing the sample, then there is chances of hemolysis, and this is accounting for the 33% of the hemolysis cases. Second important factor or cause for hemolysis is prolonged tourniquet. Whenever we are withdrawing the sample from the patient, we tie a tourniquet. So if the tourniquet is tied for a longer duration, then also the hemolysis chances are raised. It is seen that over 1 minute of tourniquet raises the hemolysis risk by around 15%. Third important cause is small bore needles. What this causes is needles with small bore, that is 25 gauge or more, increase the shear stress on the cells, leading to the hemolysis of the RBCs. Then apart from these causes, we have various other factors like difficult draws, in which we pull the plunger of the syringe forcefully, or if we are not filling the sample tube properly, or if it is due to vigorous shaking of the sample, if we are not properly inverting the tubes, we are shaking them, that can also lead to hemolysis. Also, pneumatic transport of the sample can lead to hemolysis. Impact on various parameters. Hemolysis falsely elevates the potassium levels, lactate dehydrogenase levels, AST, magnesium and iron levels. Also, RBC count will be decreased falsely, and there is some interference with the coagulation assays also. And example, we can see that potassium levels rises around 0.5 millimoles per liter for 1% of hemolysis. Now coming to the detection of hemolysis. How can we detect this hemolysis? First, we can detect by the visual inspection. As I have earlier also mentioned, if the sample is appearing pink or red in color, then we can assume that the sample is hemolyzed. Second thing is spectrophotometric index, also known as hemolysis index. This index indicates the severity of the hemolysis, and nowadays we have analyzers which automatically flag the samples with hemolytic index more than 50 as hemolyzed. So this is how hemolysis can be detected. How can we prevent the hemolysis? We can prevent the hemolysis during the collection of sample by proper training and phlebotomy techniques. Secondly, using the appropriate needle size, large bore needles of 21 to 23 gauge, so that there is less stress on the cells, then tourniquet time should be adequate. It should be less than 1 minute to reduce the risk of hemolysis. And lastly, handling of the samples should be gentle rather than vigorous shaking of the samples. Now coming to the prevention of hemolysis during handling of the samples and their transport. So first important factor which we can manage or we should keep into mind is clot formation. We should allow the proper clotting of the samples before centrifugation. We should not be in a hurry to centrifuge the samples, because if the clot is not properly formed, then also hemolysis can occur while centrifugation. Second important thing which we should keep in mind is proper mixing of the samples. We should invert the tube gently 5 to 10 times for mixing the samples. We should avoid the shaking of the samples. Okay. Then transport. While transport, we should always avoid the pneumatic tubes if it is possible, because these pneumatic tubes function on a pressure or a vacuum technology which creates a pressure on the tubes which can lead to the hemolysis. And proper temperature control during the transport is also important to preserve the integrity of the sample. So finally, what is the conclusion of all this? If we reduce the hemolysis, ultimately we improve the care of the patient. So firstly, we should recognize the causes for the hemolysis. We should try to prevent those causes, follow the best practices for collection of the samples, handling of the samples and their transport by proper training of the staff, and this will ultimately enhance the accuracy of our lab results by reducing the pre-analytical errors, and also will enhance the reliability of the laboratory. Ultimately, this whole process will be in the benefit of the patients, as patients will get better lab results, which will lead to better patient management. So friends, this was all about hemolysis. I hope you all like this video. If you like the video, share it with your friends and subscribe to my channel. Thanks for watching.